New health concerns here in the U.S. Thanks for streaming 11Alive. I'm Dan Kennedy. There are now more than a dozen reports of New World screwworm infections in U.S. animals. Thankfully, no cases reported in humans yet, and the CDC says the risk to people remains low. But this parasitic fly could have a major impact on our food supply, and it could skyrocket the already record high cost for beef. But what is New World screwworm? It's a species of parasitic fly that feeds on the flesh of warm-blooded animals and people. New World screwworms lay eggs in wounds and body openings which hatch into larvae and eat live tissue.
We hope for the best and prepare for the worst, and I believe that's where our states and USDA both are aligned.
Mostly cattle have been impacted so far, and Texas has had the majority of cases. There was also a dog infected in New Mexico. One way U.S. officials are responding is by releasing sterile flies. The USDA says it's an eco-friendly technique that disrupts the parasitic fly's ability to reproduce.
That was very successful in eradicating screwworm from the United States and all the way down through Central America back in the 50s, 60s, and into the early 2000s. And I believe it can be a successful technique again.
While the CDC says the risk to humans remains low, the agency says to watch for symptoms, including unexplained painful wounds or sores that don't heal, a foul-smelling odor or bleeding, seeing maggots or feeling movement in open wounds or sores. Any suspected infections in people or animals should be reported to local or state health officials and protect against the flies in areas where they're present by keeping open wounds clean and covered, wearing loose-fitting, long-sleeve clothing to limit exposed skin, use an EPA-registered insect repellent to prevent insect bites, treat clothing and gear with permethrin, and sleep indoors or in rooms with screens. And if you're planning to be outside this summer, you should also be thinking about packing the sunscreen. But soon, you may be seeing a new ingredient that some doctors believe will save lives. It's no secret excessive sun exposure can lead to premature aging and skin cancer, but for years, the only sunscreen options to block those dangerous rays carried concerns over chemicals or a white cast on the skin. But soon there will be a new choice in the U.S. thanks to this order from the FDA.
Many dermatologists are going to recommend it.
Dr. Deborah Sarnoff, president of the Skin Cancer Foundation, is already poised to advise patients to shift to the new sunscreen ingredient called BEMT when it hits the market. While current U.S. sunscreens excel at blocking radiation that leads to visible sunburns, critics say they routinely fail to shield against deep penetrating ultraviolet rays or UVAs. But Sarnoff says BEMT provides that adequate protection that isn't easily absorbed into the skin.
The thing about this ingredient is it's been around in Europe since the year 2000, so we have a long history on it.
Sarnoff says it protects without the white streaks traditional U.S. sunscreens leave behind, and it's good for those who have poor reactions to other chemicals or people with sensitive skin. It'll need to be applied just like other sunscreens 15 to 20 minutes before sun exposure and then reapplied every 2 hours and after swimming or sweating.
We really feel that this is going to save lives because people are going to use the sunscreen that they like, that feels good, smells good, and that's cosmetically elegant.
Well, with the FIFA World Cup bringing, thousands of visitors here to Atlanta this summer, organizers preparing for more than just the crowds, though. Georgia's summer heat, the humidity, and thunderstorms can catch even locals off guard. Meteorologist Danielle Moss explains how fans can stay safe and healthy while enjoying all the festivities.
Summer weather here in Georgia is always tough. Even if you're from Atlanta, you might still struggle with the heat, the humidity, or the pop-up thunderstorms. But we have so many visitors in town for the FIFA World Cup this year, and it's very important to know how you can be safe at all times.
From big boys showing up in Decatur to excited Cabo Verde fans at FIFA Fan Festival downtown, soccer fever is spreading across Metro Atlanta. Behind all the excitement, organizers say weather safety has been part of the plan from day one.
The World Cup is all about bringing cultures together, right? And it's not just about watching a match or watching a show. It's really about soccer culture in general.
The games themselves will be played under a closed roof at Atlanta Stadium, but outside, it's a different story. Thousands of fans are gathering outdoors where heat and humidity can quickly become a challenge.
Listen, this Atlanta heat is no joke, man. It's like it is brutal. But yeah, we definitely try to mitigate some of those risks.
With temperatures feeling close to the upper 90s, both the FIFA Fan Festival and Decatur Watch Fest are making it easier for fans to stay safe. Water refill stations, medical tents, and volunteers are available throughout the events for anyone who needs help cooling down or finding assistance. Dr. Alex Isaacov works for Emory Healthcare and is one of the leading experts managing preparedness for the World Cup. He says one of the simplest ways to avoid heat-related illness is also one of the most important.
Alcohol and the caffeine will dehydrate you, put you at greater risk for heat illness. And so I would say if you're out enjoying yourself, which you should be, enjoying World Cup in Atlanta or wherever else you might be in the U.S. or elsewhere, make sure you drink plenty of water along with it.
Heat isn't the only concern. Summer storms can develop quickly across Metro Atlanta. In fact, the FIFA Fan Festival has had to make adjustments on days when strong storms moved into the area. And with fans visiting from all over the world, it's important to understand what different weather alerts mean before severe weather strikes. Whether it's flash flooding, damaging winds, or even tornadoes, a watch means be prepared. A warning means take action and get to safety immediately. At Decatur's Watch Fest, organizers say they have a plan if storms move in.
The event takes place right on top of the Decatur MARTA station, and so in case there's bad weather, people can just duck right under the MARTA plaza and go into a safe space.
Whether you're here for just a few days or the rest of summer, it's important to stay hydrated and check on those weather alerts. You can stream the rest of those very important interviews on 11Alive. Reporting at the center, I'm meteorologist Danielle Moss.
We'll have more health news after this. You're watching 11Alive News. Imagine treating liver cancer, arthritis, maybe an enlarged prostate, all with just a simple pinhole incision, no surgery, almost no recovery time. Well, it's reality now. And we want to talk about what's going on at Emory with Dr. David Palogo, Division Director of Interventional Radiology at Emory and Winship Cancer Institute. Doc, it's great having you on this morning.
Thank you so much for having me. I appreciate it.
I'm going to need you to make this simple for me, if you can. So let's just start with, what is interventional radiology?
So thank you for asking that question.
Okay.
So interventional radiology is a specialty that most people don't know about. And it gives us the ability to manage these things you mentioned: arthritis, enlarged prostates, degenerative disc disease, so many things, cancer, without any surgery, without any cutting, without any pills, without any opioids, without any implants. It's all done. I have my prop
Let's
here.
see it, please.
It's all done. We just make a small puncture and we put this rubber tube, it's hollow. And we just sort of work our tools through here, and when the procedure's done, we take it out, we put a Band-Aid over that, and send you home.
So what kind of conditions can this treat right now?
I think the most exciting one is osteoarthritis, arthritis in the knees. We'll use that as an example. 30 million people with this condition. It's inflammation, right? And so before interventional radiology, or without interventional radiology, maybe you get a big surgery and get a knee replaced, or maybe even worse, you get opioids and narcotics and all the terrible downstream things associated with that. But instead, we can work through this thing, and we can block the blood vessels that are abnormal and are inflamed, and we can stop the progression of the disease.
Wow.
So if I get one tomorrow, I have some arthritis in my knee, it's not going to get any worse because we're getting at the underlying problem without anything other than this and some fancy imaging guidance.
Okay, remote robotic endovascular technology. Walk us through what that actually looks like. I mean, what's the doctor doing in the room? Is the doctor in the room? What is the patient experiencing?
So this is the evolution of interventional radiology. So we think about these procedures and these conditions that we can treat through here. And now what we've done, we've got a huge advantage here in Atlanta because we have Emory. Yeah. And we've got an interventional radiology division that is innovating and evolving and pushing the edge of the technology. So to answer your question, I have one more prop, which looks sort of like a game console that we have here. And we can work the tools through this same thing we call a sheath using this remotely. So if somebody is 10 feet away from me, or hopefully very soon miles away from me, we can do the case without having to stand next to the patient and be in the room, and we can do it with exquisite precision.
You said hopefully soon miles away from me. What do you mean by that?
So Emory being the first in the world to do these endovascular robotics cases locally, we are also the ones who are working on the technology to allow us to do this in Macon from Emory University Hospital.
Why is that so important for this moment when we hear so often about rural hospitals closing?
So we are in a time when rural and under-resourced populations in and around Atlanta are they don't have the same access to healthcare and the same access to complex procedures that others do. And so it's important for the healthcare system in the United States to acknowledge that these human beings need these same procedures, but may not be able to travel all the way here. So what we are developing is the technology to be able to treat them with the same minimally invasive and cheaper techniques, but from a distance.
All right, you got my attention when you said cheaper. Is this something insurance is covering, and how much cheaper are we talking about for the patient?
Absolutely, and the cost differential is dramatic. We are talking about the difference. If we use the prostate example, if we can shrink your prostate with that same day before noon and go home process, compare that to staying in the hospital for 3 or 4 days, the cost differential is quite significant. And all of these other downstream things that happen if we don't use a minimally invasive process. For example, one of the things we treat degenerative disc disease. We can do it in the same way using our imaging guidance, small punctures. We can have people out of pain. The alternative, if we compare both cost and what we call morbidity, which is the suffering of the patient, the alternative is either a big surgery, which you stay in the hospital for and recover from for weeks, or you leave with pain medications and all of the downstream effects from that, which I mentioned before. So there's a big differential between coming in and having one pinhole placed, a procedure done under image guidance, leave at noon, versus these other options.
Let's talk about the recovery time in all this. Let's say I have a prostate procedure. You use this robotic technology. How soon could I be back at work?
I'm so glad you asked this question because we recently had a story in the AJC actually about this. We had a great patient who allowed us to tell his story that will be the answer to your question. He was an ex-police officer, a very active person, and he underwent what we call prostate artery embolization, which is this procedure we're talking about in interventional radiology. And he's a hockey goalie, and he was in a championship game 2 days later.
Wow, playing hockey 2 days after having this
Exactly,
procedure.
and I think that's a great illustration of the difference.
Okay, I'm trying to think of the downsides. I mean, are there any? How much more precise is it doing this than maybe by hand?
Oh, so the precision is 1 millimeter. So it's even hard to imagine. We can use these imaging guidance and these robotic techniques in 2026 to target any place in your body down to 1 millimeter precision. And that becomes important in another space, which is sort of close to my heart, and that's the advanced management of pain now.
Okay.
We can reach a pain generator in your body. Maybe it's from cancer, maybe it's from a degenerative disc. We can reach it with this technology with such exquisite precision using either robotics or the imaging guidance or a combination that previously was unavailable to us. So it's extremely precise.
I'm curious to know, right now it's able to treat liver cancer, arthritis, and large prostates, what you highlighted right now. But what conditions are next? I mean, looking down the road 5-10 years.
So I think the biggest difference we've made now, and what will also be the greatest explosion going forward, is the management of pain, either related to cancer or not. Because the tools that we put through this thing, they can do things like freeze and kill cancer, for example. Another big thing we do is freeze and shut off the signal from nerves that are carrying either a painful signal from a tumor, for example, or another pain generator in the body, or the nerve itself might be damaged. And so that's where the explosion has happened, and that's where I see the greatest impact happening going forward as well.
When you were in medical school, did you ever think you'd be able to hold the answer to people's pain in your hand on a TV set?
Oh my gosh, I can't imagine how the world has gone, and I often reflect on how I ended up in this position. But I'll tell you, the greatest difficulty we have, the greatest obstacle we have, is getting this word out. People don't know this exists. People don't know that we can do this. I meet a patient every week that I could have helped 18 months ago. And particularly at Emory. So this interaction is super helpful, and I hope a lot of people hear this, and that's where I thank you for your help.
So you're struggling to get the word out. I mean, how? All right, so hopefully we can let patients in the Atlanta area know about this, but what about the medical professions out there?
So my colleagues in other specialties are aware, and they're our biggest source of referrals now. For example, we have, of course, as you know, the Cancer Hospital, Winship Emory Midtown, which is just a beautiful 18-floor cancer-dedicated hospital, and the folks there, patients come to the hospital because they have too much pain to manage at home. And if you can imagine that that's your relative, you can imagine that you want them to get all of the attention and all of the technology available, right? But the people who work in that building, they know. And so they call us, and we take care of those people as if they were our own relatives.
Dr. David Prologo from Emory, thank you for being here. Any final word today?
Oh my gosh. We promise that if you come to Emory, we'll work as a team to solve your problem. We'll never cut you loose to figure it out on your own.
We'll have more health news after this. You're watching 11Alive News. June is Alzheimer's and Brain Health Awareness Month, and in the U.S., more than 6 million people are living with dementia. That's according to the National Institutes of Health. And as temperatures rise, heat and humidity can be especially dangerous for patients dealing with declining cognition. For the millions of people living with cognitive decline, getting outdoors in the sunlight is essential.
It's helpful for their sleep cycle and everything, for their mood.
But Dr. Heba Khan with Cleveland Clinic says spending too much time in the summer heat and humidity is especially dangerous for these patients because it's hard for their bodies to sense and react to changes in temperature, and they may not be able to communicate how they're feeling.
So our patients are very much likely to develop dehydration, heat stroke, and other complications from the heat earlier than an average person would if they were outside for too long.
To keep these patients safe, Khan says they should always have a companion. That person can encourage walks and time outdoors, but also frequently remind the person to drink water. Since plain water is not always well received by some dementia patients, she says to try flavored water or fruits with high water content like watermelon to help their hydration. And make sure they wear sun protective clothing.
Sweating also changes actually with dementia. So most patients are not sweating like an average person would. And that's an important mechanism that our body has to let some of the heat out.
Finally, Khan says to watch for warning signs that are unusual from their baseline, like sudden changes in mental status, confusion, and disorientation.
It's best not to blame it on dementia or the progression, and it's always important to seek help, ask questions if you see something new that is a little bit unsettling.
You know, booking appointments online, logging into patient portals, virtual visits, managing prescriptions through apps. It is clear healthcare is becoming more and more digital in 2026. But some new research shows that some older adults say, hey, we're feeling left behind in all this. So here to break down what that means for patients and maybe what needs to change is Emory Health Policy Professor Ilana Greats. Ilana, good morning. Great to have you.
Good morning. Nice to be here.
So there's this new CVS Health study we're looking at here. Nearly 6 in 10 older adults say they struggle to manage their own health. And then when I list all the ways that our health is now digital, I guess you can kind of understand why, right? Does that number surprise you?
It's not surprising because since COVID, access to virtual care has really skyrocketed. Every healthcare provider is relying more on telehealth, patient portals, and different digital tools. And they're not always easy to navigate. And I think the challenges, may be more prominent among older adults, but it's really for all ages. I mean, people struggle with navigating these digital health tools, knowing how to use them and what functions are available, being able to access them, just logging in and figuring out like the password process with like new authentication requirements, and then just challenges with privacy and trust, like feeling secure with how the data is going to be stored, used, who's going to be shared with. I think those are all real challenges that health systems need to address.
You know, I'm of the younger generation, but sometimes I just want to pick up the phone and call the doctor's office with a question, and now I got to have a talk with an AI chatbot before I could ever even get through to a human. So, I mean, what kind of real-world consequences can this have on somebody who's just trying to get an appointment?
Yeah, and that's something that came out in these results and with other research that people have done, is that there is a small but consistent proportion of adults that really prefer in-person care or being able to talk to someone live over the phone. And so I think what's important is to maintain all accesses, all modalities, channels open to people, and not limit them and force them into this digital health platform for everyone. Like, you always need to be able to have a phone number with a live person available to help. And if you don't, I think digital health tools can really start to become a gatekeeper to care, and we don't want to do that. We don't want those tools to limit access to care. We want them to expand access to care.
Yeah, it's kind of a fine line, right? Because these digital tools can expand access in a way, but how do you make sure that telehealth and apps don't accidentally create like a two-tier health system?
I mean, I think let's make these digital health tools easier to navigate, easier to access, like just simpler designs, making clear like what's available in them, and B, make sure that we maintain, phone access available with a real live human, in-person visits available for the patients that need them, and not cut out any channels. But also we need to support older adults and all adults in really improving their digital health literacy with education, with outreach, with customer support. All of those things are going to be really important.
And I guess it's important now because by 2030, all baby boomers will be 65 plus. I mean, that's 1 in 5 Americans we're talking about here. So in a way, time is of the essence to get everybody trained up and ready.
Yeah, it's true. And I think with baby boomers, like with younger adults, I think they are generally very comfortable engaging with technology, which is consistent with what we're finding here. And so now I think the onus is on healthcare systems to really improve their design and training and support for the tools. But yeah, and there's a large number of aging adults with very high healthcare needs, and digital tools can help. And so we have to do everything we can to make sure that these tools are accessible.
I mean, I thought it was kind of interesting in the study. 86% of older adults say, hey, we're open to using these digital health tools. I mean, a lot of my father-in-law, like 10 years ago, didn't even have a flip phone. And now he's navigating his My Chart on his smartphone. I'm very proud of him. I mean, at this point, you're not going to put the genie back in the bottle, so we all just kind of got to get used to it, right?
Yeah, and I think for aging adults, like digital health tools and telehealth is also really help support, like if you have an aging parent and your kids live like in different locations, like it's really easy for children caregivers to help manage care for older adults. And so that's definitely an advantage of digital health tools if you can get the patient on board. I think it makes it easier to access and manage healthcare data.
I think you kind of talked about it some when we were discussing what's the solution here. I mean, you mentioned simpler design. It's helpful to have a phone number available to folks who, at the end of the day, are going to need an 800 number or just want to give the doctor's office a call. But is there any more we could be doing to helping these folks out who aren't as digitally savvy? I mean, what about family members who are caring for the older generation? Anything we can do?
Well, the other limitation here is access, right? So making sure that people have affordable access to devices, to broadband, internet, to data plans. I think that is going to be really key. And then it's just education and design of the tools. But I think making them easier to log into, easier to share, and be able to get support when you need it from both like customer service support, technical support from the platforms, but also from family members who are willing and able to help and maybe more comfortable with the technology.
And that is your health news. Thanks for streaming on 11Alive. I'm Dan Kennedy, and more news on the way next.